Hello again. This module is going to be over patient handling. Like a few of our other modules, this one will be gone over in more depth once we can have our hands-on training at a later date. But for now, I will walk you through the process in this presentation. So in the event of some kind of radiological emergency, you may have to transport an injured individual out of the hot zone. Because the area you are going into, as well as the people that you are maybe transporting, may be contaminated, you want to prepare your equipment as much as possible, as well as making sure that the patient is secure and not at risk of contaminating any first responders. To prepare your patient transport equipment for going into the hot zone, you will first need to spread out a protective barrier. This can be a tarp or a sheet. You all don't normally carry tarps in your vehicles, so if you need one, ask the fire department for one. When you're in the hot zone, this barrier will serve as your clean surface while you're working. Next, you're going to want to lay down the backboard in the center of the bottom barrier and then spread out 2 more barriers on top. These barriers will need to be sheets. The third step will be folding the 3 layers over the backboard. Once you have done so, place all the response equipment on top of the sheets covering the backboard. You will also need to place a sheet over the stretcher to help keep it from becoming contaminated during transport. At this point, you are ready to take your equipment into the hot zone. Before you ever enter a potentially contaminated area, you will always need to assess the situation. Always approach with caution and consider what kind of PPE you may need, how to avoid contaminated areas, how long the rescue may take, and what other hazards may be present. Though you need to take these steps before you enter the area, remember that patient care always takes priority over any other radiological concerns. If the patient is still alive, there is probably not enough radiation present to actually harm you. If the patient is already dead, stay away from them because they may be heavily contaminated. There are several things you may need to consider when rescuing a patient from a contaminated area. As always, you will want to use universal precautions and do your best to avoid any cross-contamination. Do not delay treatment. As I said, if they're alive, they're probably not contaminated enough to harm you. Because we are always concerned about creating an inhalation hazard by stirring up the radioactive dust, try to move slowly and deliberately. While transporting, you may encounter 3 different types of patients. Those who have been exposed, those who are externally contaminated, and those who are potentially internally contaminated. Each will need to be transported in similar ways. If they're ambulatory patients, they can assist you with their own decontamination by taking steps such as removing their own clothing. When you're transporting a patient, make sure that you're always protecting their airway. We do not want to risk internally contaminating them while we're moving them around. If your patient is wounded, only decon the wound if absolutely necessary. The hospitals will be much more equipped to handle decon, but if you must decon to treat on scene, you can decon the wound by dry padding or flushing. You will always want to decon away from the wound to make sure that all cleaning liquids are running away from the wound, but not contaminating any other part of their body. When you get to the patient in the hot zone, sit down the backboard and fold out the layers. Place your equipment on the protective layer, that bottom layer. You will want to move the patient over the backboard on top of the 2 sheets. Once the patient is on the backboard, you will need to remove their clothing. As we discussed in an earlier module, by removing the clothing, you can remove as much as 90% of contamination. So the first thing you want to do is protect their airways. So place a mask or face shield over their face. Next, you will very slowly cut their outer clothing. Always cut from the head down. You will want to make sure that you are not pushing any radioactive dust towards their face. Keep in mind that different types of clothing will require different methods of cutting to ensure that everything can be removed easily. Never tear away clothing as it may stir up particles and become airborne. Once you have cut the clothes off, roll the clothing away from the skin, trapping the particles inside the rolled clothing. Contamination will be on the outside of the clothing, so you will try to roll the clothing inside out. To take off their shoes, you will hold a bag with both hands and carefully place the bag over each shoe to remove, ensuring that the shoes only touch the inside of that bag. Again, this will all make a lot more sense during our hands-on training. Next, log roll the patient to one side and roll the first protective layer, that is that sheet, over the clothing so that the sheet is only showing. Roll the sheet to the center of the board and then roll the patient to the other side. You will roll the other side of the sheeting towards the middle and then starting from the head, roll the sheet down to the feet. Lay the patient back down and place rolled up sheet and clothing in the bag with the shoes. With all their clothing removed, you will then cocoon the patient in that second layer of protective sheet. If the patient needs any medical equipment, such as a BP cuff or EKG leads, you will need to place them before you cocoon them. Make sure to run any lines out of the top, up by their head. That way you can have easy access for connection. You will then lift the patient with the backboard and carry them out of the hot zone and place them on top of that stretcher on top of that protective barrier that you placed earlier. Wrap the stretcher's protective sheet over the patient and then secure them with the straps. Last, you will load the patient into the ambulance where they will be transported to the hospital for decontamination. Once you get a patient loaded up in your vehicle, immediately notify the hospital that a potentially contaminated patient is en route. The hospital will begin setting up their decon room and prep everything for your arrival. You will need to make sure you are following their instructions at all times to prevent any cross-contamination. While you're at the hospital's radiation safety officer will survey your crew, vehicle, and equipment for contamination. Before you leave the hospital, you're going to want to contact dispatch for further instructions. You may be told to return to service, stay in place for decon, or go to a specific decontamination site. Okay, hopefully all of that made sense. If you're still a little unclear, remember that we will be going over it again during our hands-on training at a later date. But if you do have any questions before then, please feel free to give me a call at the number listed on the screen.